I'm Jane Stewart and I'd like to welcome you to COSA's Cancer-Related Malnutrition and Sarcopenia Implementation Toolkit. This toolkit has been developed to support implementation of the recommendations within COSA's Cancer-Related Malnutrition and Sarcopenia position statement. So if you haven't done so already, it's important that you take a moment to read the position statement. You'll find a link to the position statement on the Toolkit webpage. We hope the toolkit helps you identify areas for improvement in your workplace, build your skills in identifying and managing cancer-related malnutrition and sarcopenia, and supports you to implement the position statement's evidence-based recommendations into practice, ultimately improving care for people with cancer. It's important to emphasise that putting the position statement recommendations into practice is a complex process. It requires engagement and support from within your organisation and a coordinated effort from the multidisciplinary team to develop a local action plan. In most cases, this is a multi-year process. An important starting point is to understand what is happening in your workplace now and what needs to change. The toolkit can help you work this out. We suggest you start small. Consider changes in one clinical setting or with one patient group. For example, you might start by focusing on improving malnutrition screening within your inpatient oncology ward. Or perhaps it's enhancing malnutrition and sarcopenia assessment practices for patients known to be at high risk of these conditions, such as those with head and neck, upper gastrointestinal, or lung cancer. Starting small in one area can help build your confidence to tackle changes in other settings or patient groups. Take a look at the infographic on the Toolkit webpage for an overview of how to use the toolkit. On the Toolkit webpage, you'll find resources to support screening, assessment, treatment, transitions of care, and the role of the multidisciplinary team, as well as a suite of clinical case studies and exemplars of evidence-based care in practice. We hope you find the toolkit a practical resource to support sustainable change in your workplace. Good luck.